Hi, and welcome to the Behavioral Health News Spotlight and Excellence interview series, where we feature exceptional leaders and innovative solutions raising the standards of care in the behavioral health community. I'm David Minot, Executive Director of Mental Health News Education, the nonprofit publisher of behavioral health news and autism spectrum news. Our mission is to improve lives and the delivery of care for people living with mental health conditions, substance use disorders, and autism, and to support their families and the professionals who serve them. Today, we're speaking with Dr. Jorge Petit, Executive Deputy Commissioner and Director of Community Services for the Division of Mental Hygiene at the New York City Department of Mental Health and Mental Hygiene. Dr. Petit, thanks so much for being here with us today.
Thanks, David, for having me. It's really a pleasure and an honor to be with you.
Absolutely. So to start, you served in the Division of Mental Hygiene as Associate Commissioner back in 2004 through 2007, and now you've returned as Executive Deputy Commissioner. What has genuinely changed about New York City's behavioral health landscape, and what remains frustratingly the same? And also, what are your top priorities now that you're a few months into the role?
Yeah, it's a great question, David. Coming back to the Department of Health is sort of like a homecoming, right? I was here, like you mentioned, back in the mid 2000s, and subsequent to that, I spent years, working across public sector behavioral health systems as a psychiatrist, an executive and physician leader, and now leading this division. At the health department, we know that mental health is health. And that's not just a phrase we throw around. It's how we try to organize all the work that we do. And I really look forward to, this conversation specifically around, this question that you ask about, what's the same and what's different. What I have noticed is, in the last 20 years, we've seen a tremendous investment in behavioral health services and real significant progress in normalizing mental health. That means, it allows more people to seek support and find options when they have needs. Whether we're talking about individuals with developmental disabilities or serious mental illness, or people with substance use disorders, perinatal and youth mental health, or just creating more pathways to access for anyone seeking care. The system today is fundamentally more robust than when it was when I was last here. The good news, and I want to say this really clearly, is that New York City actually has one of the most comprehensive behavioral health systems in the country. And that's not something we say lightly. It's the product of sustained investment and a lot of people doing hard work over long periods of time. What hasn't changed, despite all of that progress, are the persistent inequities in access to care. Too many New Yorkers still don't know what's available to them. And that gap between what we built and what people actually know about and can reach or outreach is something I think about constantly. We did not get here overnight, and closing these gaps is going to take some dedicated effort and time, but the health department continues to work diligently at it every day. Some of my priorities in this role, it's really about strengthening early intervention, getting people into care faster, chipping away at the stigma that still keeps way too many people from asking for help in the first place. And we know that health doesn't exist in a vacuum. So a big part of what I want to do is break down the silos, not just across behavioral health, the work that we have to do ourselves, but between behavioral health and the broader system of care that shape people's lives every day. We know that environmental factors like income level, housing instability, all contribute directly to adverse health outcomes. No one should have to choose between getting mental health care and meeting their basic needs. That's just not a choice any New Yorker should be forced into. And I want more New Yorkers to know that Division of Mental Hygiene is here to help, that there is no wrong door when it comes to accessing care. We offer low barrier, place-based behavioral health support specifically because we know we need to meet people where they are, both physically and emotionally. And that's not just a tagline, it's how we actually try to design all of our services.
Yeah, and for those who may not know the division's full footprint, can you walk us through what the Division of Mental Hygiene actually does, who you serve, what you fund, and how you work alongside state agencies like the Office of Mental Health and the Office of Addiction Services and Supports?
Yeah, so the Division of Mental Hygiene is a state designated local government unit. And as such, we take a really holistic approach to meeting the diverse needs of New Yorkers, and all of this works within, the healthy New York City goals, which are all about increasing life expectancy and health span for everyone in the city. So the Division of Mental Hygiene manages a budget of over $960 million with over 700 staff. We work with and fund more than 200 community-based providers to deliver more than 800 programs spanning mental health services for adults and children, substance use disorders, services for justice impacted populations, and community outreach. We also have a very, very sizable portfolio of supportive housing, over 13,000 supportive housing units. And all of this work happens as a local partner to state agencies, as well as sister agencies, city agencies, including the Department of Social Services, New York City Health and Hospitals. We work very closely with the State Office of Mental Health, OASAS, OPWDD, where we oversee state licensed mobile crisis, ACT teams. We manage local naloxone distribution efforts, support syringe service programs and providers. We also have a significant number of city-funded teams doing direct outreach in communities, engaging justice-involved New Yorkers. We run workshops that build day-to-day understanding and mental resilience. And I want to be clear that the division is just one arm of a much larger agency. We work together across the health department to support a healthier city overall. Mental health is health, and that's not just a phrase. It's something that we actually do in how we integrate our work.
Absolutely. Three of the biggest pressure points for the Division of Mental Health right now seem deeply connected. Advancing health equity, meeting the youth mental health crisis, and supporting a provider workforce that, as we all know, is stretched thin. How are you thinking about these three challenges together, and where does the division have real leverage?
Yeah, it's a great question. It's something that, I've been working towards my entire, career in public sector, right? Thinking about, all of these issues. So equity is woven into every aspect of our work. It's driven by both the data and community input. And the goal is to always make sure that the communities most impacted are the ones that are actually receiving supports, not just in theory, but in practice. For example, on youth mental health, I come to this work not only as a psychiatrist and a public health leader, but as a dad, right, as a parent. And I know how important it is to meet young people where they are in ways that actually resonates with them. We support youth mental health through programs, research, technical assistance, and guidance to providers and to New Yorkers more broadly. That includes partnering with agencies like New York City Public Schools. We host, site-based mental health clinics and training youth-serving providers to strengthen how they respond to young people's needs. We also launched fascinating, amazing, initiative, this youth suicide prevention program with health and hospitals, specifically to follow up with young people after they've been seen in an emergency department for suicide-related behaviors, because that moment matters enormously. And we convened the Youth Committee on Mental Health made up of young people between 15 and 24. So we're hearing directly from them on our policies, our programs, and our strategy. Not just designing things for them from the outside, but really bringing them in to think about how we designing these and implementing these programs that are going to reach them differently. Our workforce, New York City is proud to work with, we're proud to work with providers on the ground to support employment pipelines. And that includes recent funding announcements on expanding support for perinatal mental health and for peer certification specifically. I want to highlight that our peer workforce in particular, because we just celebrated our 20th 20th anniversary of our peer conference, which we have done for now 20 years. And I think it's one of the most valuable assets we have. We're proud to uplift more than 630 peers across the behavioral health workforce and directly employ many through the health department. These are people with lived experience who reach New Yorkers in ways that traditional clinical roles sometimes can't and doesn't. It doesn't resonate in terms of, where folks are at. So we're really trying to meet people, where they're at as much as possible.
Yeah, I'm so happy to hear about the emphasis on supporting the peer workforce. So when we've checked back in a year, I'd love to chat with you again after it's been some time. What would need to be true? What would have to have happened for you to feel like this was a good first year for the Division of Mental Hygiene?
That's a great question, which I grapple with all the time. Honestly, I think, what's going to be important for me is, how are we going to close the gap between what we know works and what people are actually experiencing on the ground? I want a New York City where no one falls through the cracks, not because they didn't know where to turn, or not because the door they knocked on wasn't the right one, and not because the system just basically gave up on them. We have real infrastructure in the city, and I want to make sure that we're deploying it in a way that makes the most amount of sense, meeting people where they're at, not where we expect them to be. I believe truly that government has a fundamental obligation and a moral one to be a resource for all the people that we serve, including those that fall through the other safety nets. And I want to make sure that we're supporting New Yorkers living with serious mental illness, those in acute distress, those with substance use disorders, those that are justice impacted or have housing instability with real dignity and respect. They have preferences, they have histories, they have things that matter to them. And our job is to honor that humanity, even as we're providing the support. So if I can look back in a year from now and say we made real progress, measurable progress on that, it means that fewer people are falling through the cracks. More people have found the right door the first go round. That's what success will look like to me.
Well, Dr. Petit, it's clear that the Division of Mental Hygiene is in very good hands. I know I speak for many that we're all very excited to see, how things evolve under your leadership. Thank you for your time and for sharing your vision with us today.
Thank you, David, for the interview. Good seeing you.
And for those who want to stay up to date on what's happening at the New York City Department of Health and Mental Hygiene, follow NYC Healthy on social media and visit nyc.gov/health. And to everyone watching, thank you for joining us today and stay tuned for our next behavioral health news spotlight on excellence interview.